All right, good afternoon, everyone, and welcome to the fourth of 6 business and information listening sessions presented by the Wyoming Business Council. My name is Warren Appel. I will be your facilitator today. We're going to cover a few housekeeping matters, and then I'll turn things over to Josh to introduce our agenda and panelists for this session. Written questions may be submitted using the Q&A function on your webinar toolbar. We will share these with the panelists as time allows. Please do not submit questions via the webinar chat box. They do tend to get lost, and we are trying to track all of those and get individual responses out. Individuals wishing to speak or ask live questions should utilize the raise your hand feature on the webinar toolbar. Please don't be shy. Please keep your microphone muted at all times when you're not speaking and keep background noise to a minimum. This, of course, is polite for everyone attending today, but will also help us ensure we have good quality audio on our recordings. On the subject of recordings, we are recording today. We will make this recording, as well as those from our other sessions, available on our website, wyomingbusiness.org, as soon as possible. With that, I will hand you off to Wyoming Business Council Chief Executive Officer Josh Durrell, and he will introduce our agenda for today.
Great, thanks, Warren, and really appreciate everyone joining in today and taking some time to learn about these orders and how they're changing tomorrow. And just wanted to let everybody know that, as the Business Council has worked through this with the number of businesses to work and relax these orders as best we can, the thing that we always wanted to make sure that we're doing is we're balancing those the concept of health with the concept of business. And I look at it as we're balancing the efforts to really impact lives and livelihoods. And it's important for us to know that public health is a great concern, and we really want to make sure that we're being respectful of that, and we're doing this in a smart way so that we can protect the public health, but also really make sure that we are thinking about the longer term of this with our businesses and realizing that starting up only to stop again and take a couple steps back can be maybe more detrimental than what we're doing today. So easing into this is what we're going to talk about, how we do that, and as well as the important concepts for those businesses starting back up. I want everyone to remember that it's definitely not back to normal, that these are, there are some limited business functions that we'll talk about today that will allow people to go back to work, and they're going to be driven by health metrics, and we've got a number of folks that are going to be able to talk to that. And I just want to make sure too that businesses realize that the key to this is going to be working with your staff, working with your customers, and working to make sure that you're working in these guidelines and that we're doing our best to maintain public safety so that we can continue to slow the spread. I think Wyoming has been spared because of the people in Wyoming doing a great job of doing everything they can to slow the spread of this virus. And we want to continue that and to make sure that it is slow and within our health system's bounds. And I just want to also remind everyone that we've had this question a lot throughout these webinars, is that if your business matches up with the guidelines in orders 1 and 3 that we're going to talk about, you do not need to submit any sort of documentation to your county health officer, the state health office, or the governor. Your job is to just make sure that you meet those guidelines and that you are able to operate within those guidelines, and then you're able to operate in that limited capacity. So we'll go ahead and say that a few more times. I know that it's difficult, as we mentioned in the previous webinars. The legalese gets a little difficult to read, but it's important to know that if you meet those guidelines, you may open up in a limited capacity starting tomorrow. With that, I'm going to introduce our panelists. We have a number of folks who are available from various agencies within the state, and as I mentioned these folks, I just want you all to know that over the course of the last few weeks, I know that the Department of Health, the governor's office, many agencies throughout the state have been working really, really hard and some, really burning the midnight oil to make the best decisions for us and working hard. And everyone is really, I would say, from every agency is working to make sure that the people that they impact and that their area of expertise is utilized so that we can balance that lives and livelihood. And along those lines, we have some great representation who will be here to answer questions. I know we've got a number of folks from the the Department of Health, we have Stephanie Pyle. I believe she's on and she's the Senior Administrator from our Public Health Division. We have Stephen Johansson, who's the Deputy Director of the Department of Health. We also have Sharon Bennett, who's the Executive Director of the Wyoming Board of Cosmetology, and a representative, I believe it'll be Nikki Anderson from the Department of Family Services today, who are going to be able to answer questions because, again, there are things that are changing. It can be a little bit confusing, and we just want to make sure that you have a conduit to those experts throughout this webinar and into the future. So with that, I'm going to actually take a quick look at the agenda and help everybody understand where we'll be today. Our goal is to leave as much time for questions and answers, and typically speaking, that happens, usually we take about 30 minutes to talk through these slides and then have about 30 minutes for Q&A. But we're going to take a look at the health metrics that are driving these decisions. We're going to take a look at some of the businesses that are open and making sure that people can promote that out. We'll take a look at how Order 1 affects childcare, restaurants and dining, gyms and fitness. We'll take a look at Order 3 and how those changes will impact the personal services industry. And then we're going to take a look at what is called the variance or exception process. And that's a key component for, I think, to work within these guidelines and to perhaps vary from them, working with your county health officer as well as the state health agency and so on, to make sure that we're operating in a safe manner and give you some flexibility if necessary. With that, I'm going to turn it over now to the folks at the Department of Health to talk a little bit about these health metrics that really are, again, driving the decisions we're making.
Thank you, Josh, and good afternoon, everybody. My name is Stephen Johansson. I'm the Deputy Director for the Wyoming Department of Health. Before I get started going through some of these metrics, two things. Number one, I just want to thank Josh and his entire team in the Business Council for setting up this series of webinars. So far, this is our fourth one, and it's been extremely helpful, hopefully for the people that are attending these webinars to get some information. But it's also been really helpful for us because your feedback as our business community, our small business owners, et cetera, is invaluable as we work through this process of easing restrictions and knowing moving forward with what we need to do with these public health orders. So far, just in the first 3 of these webinars, I've really been able to discern some things that could use some clarification, some guidance that we could send out. And we wanted to have these conversations, before we took the dive and decided as bureaucrats at a state agency of all of the information that we thought you all needed. Your questions and your feedback through these webinars are hugely helpful for us. So thank you. Second thing is thank you all for taking time to participate in this afternoon. I know you're all very busy and we just really appreciate the participation. So like Josh said, I wanted to take just a couple of minutes and explain to you what you might have already seen in some of the press conferences that the governor held or some of the news that's been out there, but wanted to explain in a little bit more detail some of the metrics that we're looking at to know when it's time to take action, either more restrictive action or easing restrictions from the actions that we've already taken. We are looking at these metrics on both a statewide basis as well as a county by county basis, understanding that no one county across the state of Wyoming is experiencing this outbreak and this virus in a uniform manner. We know that there are counties that have more problematic number of cases or healthcare capacity concerns, and other counties that frankly don't have much in the way of cases or have been relatively stable over time when it comes to COVID-19. So just to walk through some of these a little bit, starting on the left-hand side of your screen, where it says COVID-19 in Wyoming, these are really what we consider epidemiological metrics or measurements, and relatively straightforward and don't require a whole lot of explanation, but just bear with me while I give you a little bit more detail on kind of what this means for our decision making. First and foremost is the global metric. This is the real day-to-day number that we're looking at statewide and on a county basis, and that's the number of new cases. New COVID-19 diagnosed cases on a daily basis is one of the numbers that we really need to see moving in a different direction before we take additional legal or administrative actions when it comes to easing restrictions that have been put in place. And over the past week, the reason you see that it's still coded as red or concerning is we did see another spike, especially at the beginning of the week and over last weekend in the number of cases that have been diagnosed. But like I mentioned, that's not in every county. It's really some hot spots that we have here in Laramie County, Natrona County, Fremont County, Teton County. That's really where we're seeing some concerning trends on the number of cases. And we really want to see this number in order to be stabilizing or improving. We want to see a steady reduction over multiple weeks of those daily number of cases that we're finding. And as you all probably know, that's really sensitive. That number is really sensitive to the number of tests that we're able to do in the state and able to process both at our public health lab and our private and commercial labs. But still, we're still grading that as concerning because we want to see that number start to turn in the other direction, hopefully in the coming days and in the coming weeks as we approach the new deadline of the new orders, which will be May 15th. The second metric there that you see is the percent of those positive cases that we attribute to what we call community spread. And essentially what this is when the epidemiologists diagnose a case comes back positive from a laboratory sample. We try to divide that up into two things. One is the epidemiologist will do what's called contact tracing and will determine if the person who has a positive diagnosis got the virus from a known contact or what's known as a direct exposure. And that's what that contact tracing determines is, can we trace that back to somebody they came in contact with who was COVID-19 positive, or a presumed positive that we think, okay, this was a direct result of contact with another positive case. When the epidemiologist can't trace it back to a specific person or a specific direct exposure, it's what we attribute to the term community spread. And that means we don't know how the case developed. We don't know if it was a direct exposure. And that tells us that there's probably wider spread of the virus in that particular area, community, county, what have you. And that's what is known as community spread or community transmission. We want to see that be stable or decline. And right now, the total number of cases, we're seeing about a 20 to 25% attribution to community spread. And like I mentioned, we don't want to see that climb or this would be graded as red or concerning. But we've been pretty stable on the amount of cases that are attributed to community spread. We'd like to see that continue to stabilize or reduce. Third in this bucket is the percent of all tests that are positive. And Wyoming and some of our neighboring Mountain West states come out pretty good on this metric, relatively speaking, to other states in the country. We're currently seeing about a 4 to 5% positive rate of all of the tests that are conducted. And we've conducted between 9,000 and 10,000 tests in the state of Wyoming and approximately 400 positive cases. So it's a relatively low percentage when you look at us compared to Colorado or some of your more populated states. And we want to see that also continue to maintain or to reduce for a number of weeks before we know that we can potentially take legal action and ease restrictions. The bucket that you see on the right-hand side of your screen is hospital or healthcare system capacity. And on a daily basis, in partnership with our hospitals who report these data to us, we're collecting the metrics that you see here. Number one, total reported COVID-19 hospitalizations. And we've seen that be relatively stable over the past week and a half or so, coming down a little bit on a statewide basis. But again, on a county by county or hospital by hospital basis, we are seeing some noise, some spikes here and there. But overall statewide, that's relatively stable. And we want to, similar to the other metrics, we want to see that maintain and really reduce over the coming weeks as we approach May 15th. Second is our total hospital bed availability, and third is our total ICU bed availability. And this is, again, for the state to be monitoring this on a daily basis to determine how our healthcare capacity, healthcare system capacity, is looking in the event that we did have a surge of the virus and folks who meet that higher level of care that need hospitalization or even ICU admissions. And we do see that with this virus for certain populations that require a higher level of care. So those are kind of the 6 high-level metrics that, like I mentioned, we're monitoring on a statewide basis as well as a county-by-county basis. But I want to make one point here in closing on this topic, that we've heard a lot of feedback on, okay, what are the trigger points? What are the metrics, or what are the numbers that you're looking at that will tell you when to take action? And that's more difficult. And as a silly hypothetical example, if we reached a certain percentage of ICU bed availability, that number won't necessarily tell us, okay, now we can ease restrictions on gyms, or now we can open up schools, for example. There's not one metric that's going to tie to these administrative decisions. It's really taking a look at these metrics holistically and almost impressionistically to see, as a health department, as a governor, as a state, or on a county-by-county basis, how much risk do we think we can bear to, number one, keep the population, staff of businesses, residents of Wyoming, keep them safe, keep the transmission low, and also ease restrictions. And that's the balancing act that Josh mentioned at the beginning of this webinar that is really difficult. And we know there's not an hour that goes by in the day that we're not balancing the impact that we're seeing both to our economy, to our businesses, to our population in terms of their livelihood. While these orders are in place, it is a tough balancing act to navigate. But we're really looking for these 6 metrics. We want to see, to put it very simplistically, a lot more yellow and green on these before we know we can take even more easing of restrictions and more measures to kind of walk back what has been put in place. So I know we do Q&A, questions and answers at the end, and I'll address any questions that come up specific to the metrics, but just wanted to give you a sense of what we're looking at a high level, both statewide and countywide. Thank you, Josh.
Thank you, Stefan, and we definitely appreciate that. And the dashboard does make it a little bit easier to understand and help everybody see what's going on. So thanks for explaining that, what all of that means. One of the things that we've said all along from the governor's office is that, hey, there are still many businesses that are open. And so to that end, the Business Council put together a number of these businesses and put them into a map so you can see them. We're also still taking that information in. So if you're a business that is not represented at this website at wideopenwyo.org, you can input your business by going to the top right of that page and giving us the business information for you, your current state of whether you're open or not, what services you're offering, and also your hours of operation. That is just one of the channels that you can utilize. And of course, we want to take this moment to remind you, and we probably don't need to, but remind you to make sure that your social media channels are also up to date, and making sure that your website and that your Google listings and things like that are up to date, and so that patrons can find you and understand what your hours are and what services you may be offering at this point. So again, if you get a chance, please go check and see if your business is there, and then and add that if you need to. Another resource that we found, our Main Street manager, Linda Klink, found this website through a webinar that she attended on helping Main Street type businesses open up and how they can make sure that they're maximizing their business at this challenging time. And really, this website at reopenmainstreet.com is just a fantastic website that provides information about how to leverage your services today, how to make sure that you're thinking through what a reopening might look like if you're doing that. And it does it by breaking it down by a number of different groups and industries. So it goes retail businesses, maybe it's services. It has information for community leaders. And so just a good wealth of information, and not to necessarily say this is the only site for that, but to really help everybody understand that this is a time within your business and in your community that it's time to reach out and make sure that you're talking with the other businesses in your town learning from what they're up to, and picking your head up and looking around a little bit and looking at the outside world to see what kinds of best practices might be out there so that you can take advantage of those and help your business at this time. We definitely know it's a challenging time, but there is a lot of good information out there, and we hope you are able to take advantage of it. This is just one example of that. Now we'll get to the main feature of today's webinar for sure, and that is what is changing within the orders tomorrow. And I misspoke at the beginning of the webinar. Our representative from the Department of Family Services is Stony Bush today. And Stony will be walking us through some of the major changes that under Order 1 that will be occurring tomorrow or available. So with that, Stony, would you mind taking a crack at that?
Sure, thank you. As you said, I'm Stony Bush. I'm a regional child care licensing supervisor with the Department of Family Services. And we also wanted to thank the Wyoming Business Council for hosting these webinars and providing the opportunity for folks to understand the orders and ask questions. The requirements for child care providers from the new public health order are now on your screen. And to help make everyone aware of the changes, we have also emailed the order to all child care providers in the state of Wyoming for their review and to refer to as they are making decisions about reopening. Let me begin by saying that we know that child care is an essential part of the infrastructure of Wyoming, allowing essential systems to function. And as such, child care has been an interesting function since the state has begun to respond to the outbreak. Child care has been impacted in a different way. Not all child care was required to completely close, and many of them have been able to remain open and serve children of essential personnel. The new public health order allows for child care to reopen and expand for those who were open, who they can serve, keeping in mind children of essential personnel will still be a priority for service, and also keeping in mind the health and safety of the children, families, and staff. We encourage child care providers to reach out to their local county health officials to get guidance on the application of the public health order. The public health order is different from our child care licensing rules, and because of that, we recommend that child care providers contact their licensor for technical assistance as they begin to operationalize the public health order. We recognize that some of the requirements may be a little bit tricky, but some child care providers who have remained open have found creative ways to meet the requirements and keep children and staff safe along the way. And your licensor may be able to connect you with a provider who has been open and operating and figured out ways to meet those requirements of the public health order while still meeting the needs of the children and families. And lastly, I just wanted to let everyone know that we are developing an FAQ with all of the child care questions from these webinars, and we will make it available to all child care providers, as well as putting it on the DFS website to help people. Thank you.
Thanks, Stony. Yeah, thank you, and thanks for being available for questions. I think it's a really key component, and I think it shows how open your agency is to taking these questions in and providing the FAQ and making sure that people utilize the other child care facilities within their community and their friends and neighbors to talk with them about what they've already done in order to meet these. And so I think, facilitating that community feel as well as being able to answer those questions, we really appreciate DFS for doing that. And so thanks for being here today, and thanks for being available for questions that will come up at the end of the webinar. So thank you very much. Now we'll jump on to the next change to order number 1, which really deals with restaurants and dining. And I know this one tends to be one that gets has a lot of questions. Hold on, I apologize. My dog is barking in the background. So I'm going to let Stefan take a crack at this one. Thanks, Stefan.
Thanks, Josh. And we all know the pains of our children or our pets getting in the way of business meetings. But it's nice to hear that life goes on even in our teleworking times. But anyways, for order number 1 that I'll get into in terms of the changes to restaurants and dining, which are relatively minor. And I know everyone's kind of been excited or clamoring for when restaurants and bars and taverns and the things will be, those restrictions will be eased, and we're not quite there yet. But before I dive into some of those changes, I want folks to know kind of the logic from a public health and a Department of Health standpoint with how we put these orders into place and what the plan is for relaxing them. In addition to monitoring the metrics, which is really the most important, I want you all to know some of the logic, so at least it doesn't seem like we're totally shooting from the hip with this kind of stuff. And as you might recall, order number 1 was put into place originally, and the logic behind that was there were closures and restrictions on certain types of businesses that generally involve soliciting larger gatherings of people. So when you think of restaurants, bars, schools, childcare providers, gymnasiums, et cetera, those are places where typically more than 10 people will gather and be in either confined areas or have pretty close contact. What we know about this virus, about COVID-19, from a medical, from a scientific, and from an epidemiological perspective, is not a whole lot. It's a new virus. Information is coming in every day that educates us on its transmission, its spread, et cetera. But what we know about this particular virus, similar to others, is that the transmission among people who are gathered together is the most risky variable in terms of its spread and how folks who are even asymptomatic can pass it along to others. So order number 1 was really intended to target the businesses and the areas that solicit those larger gatherings. Similarly, order number 2 was put into place for general, large gatherings. Order number 2 prohibits gatherings of 10 or more people. So think of things like public events, conventions, sporting events even. That's really what order number 2 was intended in a more general sense to kind of build off of order number 1. And then order number 3, which we'll talk about a little bit later in this webinar, was some of those personal care services that may not solicit large gatherings of people, but are high touch and represent more of a unique sort of public health threat when it comes to virus transmission. And so those 3 orders were put into place. And now as we see metrics improve, and as we see, our number of cases reduce, hopefully, and our transmission rates go down, we're kind of going in the reverse order with easing restrictions. So folks might ask, well, how can you open up, a hair salon or a nail salon, but not, a restaurant? And that's a very good question. But like I mentioned, the large gatherings of people are really the big variable here. And those businesses, the reason order number 3 has been relaxed first is because that's more controllable with additional precautions and distancing and sanitation. That's less risky than, say, opening up public events, for example. So that's kind of the logic behind how you'll see a lot of these changes unfold in the coming days, weeks, and hopefully not, but potentially months of this outbreak. So with what has changed with order number 1 as it pertains to restaurants and dining, it's really pretty minimal in that folks can now go into the restaurant 5 at a time to pick up food or beverage orders. And that's really the most important, and we understand, a minor change to the restaurant and dining component of order number 1. But again, wanted you to understand some of our logic from a public health and from a medical perspective on how this will unfold. So as we'll talk about gyms, and we'll talk about the personal care services here in a bit, but I think it's important to understand that, again, we're not just picking and choosing from the health department kind of at random of what to relax. There is some method to the madness, but it's important to understand, in addition to that, we just don't know a whole lot, both here in Wyoming, nationally and internationally, about this virus, and we hope to learn more in the days, weeks, and months to come. Thank you, Josh.
You bet. Thanks, Stefan. And yeah, that one's definitely the biggest challenge of these 3. And so we'll step into the next one, which is gyms and fitness centers. And we'll talk through these, and I'll take a little bit of time to talk about these. I think the big change is that, yes, gyms are going to be available to be open May 1st. And these are the requirements for that. And we'll talk a little bit, maybe you're not able to see these on your screen. Maybe you're wondering exactly what they are. We have a link to the full documentation at the end of this webinar, and you can find the full orders there that will go into effect May 1st. But first and foremost, let's go through some of these. The staff must wear face coverings at all times. They do not need to be medical grade. Rather, the cloth masks will work. management needs to ensure that no employee who presents symptoms of illness will be permitted to work. One of the questions that we've had over the last few webinars is what are those symptoms, and can you define those? And so the Department of Health is putting a page together on their website to list out those symptoms and what you need to do. No close contact activities, and this is of course for the social distancing aspect of it. No one-on-one personal trainer training or weightlifting with spotters. So as I was saying, maybe if you need a spotter and you're trying to get that max effort on bench press or squat, maybe take a couple weeks off still and work on those in another way. Locker rooms, because of the challenges with cleaning as well as with the ability to congregate, those are going to remain closed. Workout equipment must be 6 feet apart, again, that social distancing aspect, as well as cleaned by staff. And so this again brought up a number of questions about who should clean that after each customer utilizes it. And in the case of many gyms, they ask that people clean up after themselves. However, because we can't really mandate how people clean up, and we all know that some customers are better at cleaning than others, we would like management to do that because they are properly trained, employees of the facility to do that because they're properly trained and can make sure that the cleaning is done in a manner that will take care of it fully. And I think the other big thing that we got a lot of questions on have to do with the spacing of people within your gym and making sure there are H and K both talk about the spacing that needs to be required for those the confined spaces or your overall gym. So take a look at those. Group workout classes are not allowed. Those are prohibited. And we just want to make sure everybody understands that group workouts are not available and cannot be used. However, we do want to say that you can, and this will come later, depending on the layout of your gym and depending on what you're doing, you may be able to ask for an exception, and we'll talk more about that later, how that process works. That question has come up quite a bit. So the other thing that you want to think about, and most gyms do this, has to do with contact tracing and keeping a record of those individuals who are in your gym and what dates and times they are, so that you can facilitate the contact tracing if necessary. You won't have to do the contact tracing, but we would like you to keep records so that the Department of Health could do contact tracing if necessary. And then finally, swimming pools, one swimmer per lane, and spas and saunas will remain closed for the time being. With that, we'll go ahead and jump into the personal care services and order 3. And again, I think we have Sharon on the line for that. Sharon?
Good afternoon, and thank you. We do have these orders, the conditions posted on our webpage. We have the full order. We also have just the conditions A through J posted right on front so everybody can clearly see what those are. We're working as best we can with everybody to get any questions regarding these orders answered. And if we don't have the answers, Stephanie at the Department of Health has been amazing in helping me find the answers for people. All of our rules and regulations still apply. We're an infection control agency. We also have information online on guidelines for reopening. They basically are just our rules, but right now we have to be more diligent than ever regarding infection control to keep our people safe. I said earlier that we're just asking that people really take their time. You can open tomorrow, but you don't have to. If you feel you need to take the weekend or a week or whatever time's necessary to do this right, that is definitely what we're suggesting. And we're also asking the patience of the public. As your stylists and barbers start on this back into reopening, they're not going to be able to take as many clients as they normally do. They're going to work hard to get you in, get you back where you want to be, but it's going to take some time to get everybody back in the salon and the barber shops they're going to need a lot more time in between clients. They're probably going to be asking you to wait outside until they're ready for you. So just be patient. I think it's great for the public to be going on in our webpage as well and reading these so they can see what's expected of them as well, and to help those stylists and barbers do this correctly. So I'll just get off here now, but if anybody has any questions at the end, I'd be happy to help.
Great, thanks, Sharon. And I know that you know, a couple things for those businesses that are reopening in a limited capacity. Some of the things to consider are, again, as Sharon mentioned, you know, making sure that your customers are comfortable with how you're handling these guidelines, because as we know that many folks are going to be a little bit hesitant to come back and take advantage of these services. And so we want to just make sure that we promote out there as businesses, we promote the way we're handling these guidelines, what we're doing to ensure that they are safe, and that we're taking care of our employees and our customers as best we can. And so I think that communication is really important, and helping them understand their part in it as well. So thanks, Sharon, for that. Now we're going to jump into the, you know, what we'll call the variance and exceptions, and how those decisions are made, and the process for any exception or variance. And to describe that, we'll have Stefan from Department of Health take a crack at it.
Thank you, Josh. Before I do that, there were a few comments before in the other topics where it was mentioned when it comes to gyms opening or personal care services opening and screening staff, especially employees, for symptoms of COVID-19. We did put together a guidance document on what questions or screening questions should be answered. That is available on our website, and Josh, that's as of just a couple hours ago. So we'll make sure to link you guys to a copy so that you can put the word out as well. You know, again, I want to echo what Sharon said. We really appreciate everyone's patience with this. This is a new virus, and we're trying to do the best we can on getting appropriate guidance out there. And it's events like this, frankly, webinars like this, where we kind of see some of the gaps in our communication, in our guidance that's out there, or that could be out there. And that's one of them that is now there for businesses to know what questions to ask their employees when it comes to potential symptoms of COVID-19, and what to do if you think one of your staff members might be exhibiting those symptoms, as well as resources that we've linked to from both Department of Health and the CDC. So moving on to this process for exceptions and variances at the county level. Before I get into the process, I want to draw the distinction for you all on these kind of legal terms and what they're intended to do. What's called a countywide variance order is something that the county health officer would submit to the state health officer that essentially replaces a statewide order for that entire county. So think a little bit bigger than what we'll talk about with the exception requests. And that variance order could be either more or less restrictive than the statewide order. For example, if a county health officer thought the conditions were justified with the epidemiological data, the metrics, everything we talked about before, that a completely new order should be put into place that's less restrictive for Natrona County, for example. That would be what's called a variance order, that particular county would have a different order operating than what's in the statewide order. What I think most of you all will be more interested in is what we call exception requests. And that's where specific businesses or entities or groups of businesses or entities would request exceptions to certain content that's in one of the three statewide orders. For example, if a school in a county or a trade school or a college, community college or a university wanted to completely reopen, but with some additional measures in place, they've developed a plan for distancing, for sanitation, for all of the things that might be necessary to keep everybody safe. They could propose to the county health officer an exception request. And the county health officer can consider that, what you see here in steps 1 and 2, can consider that, review any planning documents that that particular business or group of businesses might have, to show how they would make this safe, mitigate risk, etc. And ultimately, the county health officer would either deny altogether or kind of elevate that now as a proposal to the state health officer, which would be discussed with the Attorney General, and at that level now at the state, either approved or denied on kind of a specific exception process. So those will certainly be handled, both variance orders and exception requests on a case by case basis. And it's important to remember that these have always been part of the orders, the exception request and variance process. And in fact, we had counties that proposed more restrictive orders than the statewide orders because of what they thought was justified by the local conditions or the county conditions with respect to the virus. But this process has always been there. We're just trying to communicate it now that we're in a hopefully moving into a state where we can begin to ease restrictions. Wanted to communicate a little bit better about how that process could work. Josh has been really good explaining on these webinars that realistically and operationally, we want to try to limit, we don't want 1 million requests from every business or entity coming into the county health officer. So what we've tried to reinforce or reiterate is as much communication that can happen at the local level or at the county level, or even at the business level with, say, gyms or restaurants or other types of businesses, kind of talking to your peers, talking to your colleagues about plans that you might have for either easing restrictions or reopening. That can be a very powerful tool before approaching your county public health office and your county health officer on a potential exception request, if you're kind of in line as a community or businesses in a community on how this should look. I do want to reinforce here that county health officers do have quite a bit of discretion in this, and we have 23 counties and 23 county health officers where, again, conditions on the ground may or may not justify from a health perspective easing of restrictions or more restrictive conditions. So just know that we know this is a kind of a frustrating process, but we think that this strikes the right balance between the right amount of local control as well as state decision making that doesn't have to be one size fits all, but can be tailored to our various counties. So I know there will probably be a lot of questions about this, and happy to answer those. But Josh, I'll stop there and see if you have any comments or things that I might have missed.
No, I think that was handled really well, and I think I just want to reiterate that, again, if your business fits within the guidelines that take effect on May 1st, you do not have to go through an exception or variance process at all. You may begin operating according to the guidelines that are listed. And I do want to address that the guidelines can be the orders can be a little bit confusing because there's sort of two parts. And again, Stefan and I have kind of worked on this throughout the webinars. The first part of it talks about how things are closed until May 15th, unless you meet the conditions below in the next paragraph. And so while it can be a little bit confusing, you need to kind of read into that second paragraph and say, okay, my business actually fits these guidelines that are proposed in the second paragraph, and I can open on May 1st in a limited capacity, as long as you meet those guidelines. So again, it can be a little bit confusing. Hopefully this webinar helps clear some of those things up. We're happy to take questions. As Stefan mentioned, this can be a big challenge for your county health officer. And really, I realize that, again, depending on the metrics within your county, some folks may advocate for you to be even more restrictive. So we just want you to exercise a little bit of collaboration, cooperation, and work with your county health officer to make the best decision for your local communities. With that, we're going to jump into questions and answers, and I'll do my best here to read through these. And again, with my panel of experts, we'll do our best to answer those. So I'm going to jump in here, look at some of these questions, and feel free also to raise your hand. And Warren, I might have you look at those live questions and see if people want to ask those, as it's a little difficult for me on this current technology to see that. But I'll ask a few of these that have been chatted in. So this one comes from Morgan. There's actually two from Morgan that I think are really important here. If we have an open concept gym layout, do we count as one space, or can we clarify our own spaces?
And Josh, this is Stefan. I'll take a stab at that. Morgan, that's a great question, and I would again refer you to the order number 1 that kind of spells this out. And there's kind of two things going on. One is kind of a general identification or definition of what a confined space is. So I think for an open gym layout, it's a little bit of both. So there's two things. One, what is the open space? And two, there's a provision in the order that says, no more than one patron for 120 square feet. So I would take a look at that. But also, this is a really important time to remind everybody that when it comes to the exception process, this could be one of those areas where, for example, an open gym layout or a CrossFit gym, for example, that is kind of one room but might have limited people in a single space, and you could distance with 6 or 10 feet between patrons or equipment, could potentially apply there. So your best bet, because I don't know your specific layout, is to talk to your county public health office. And I know that seems like a punt of an answer, but at the risk of giving you legal advice, which I shouldn't be doing as a non-attorney, I would talk to your county public health office on that reopening and what they would say is your space considerations with your particular gym. So I know it's kind of a general answer, but I would look at both that language of confined space as well as the patrons per 120 square feet. And then Josh, sorry, not to jump in place of you, but Morgan asked a second question that I see in the box here that says, do we deny out-of-state members while checking into our facility? There's nothing that in order number 1 for gyms that specifies any in-state or out-of-state residents. So that's really a business decision that, again, I would talk to your your leadership or your attorneys or your insurance folks on that. But there's nothing in the order specifically that talks about any denying of service to out-of-state clientele.
Okay. Let's see. Let's jump in here. I do have a question from, it looks like a retail fireworks facility is asking if there are any orders or requirements for fireworks retail or general retail that might apply to them.
Yeah, Josh, that's a great question, and the short answer is no. In terms of retail settings, healthcare facilities, et cetera, were exempted essentially from order number 2, which is the gatherings of 10 or more. I think the language that I would direct you to in the orders is for a business like a firework, a retail establishment, looking at your social distancing within the retail establishment is a huge part of keeping folks safe. So it's very similar to the reason we our orders didn't close grocery stores or gas stations and convenience stores that provide food is obviously, their retail settings, and in that case, essential services, basically. But we did issue guidance to retail establishments to, as much as possible, limit the amount of people that come in. If you can, try to distance folks so we don't have clients or customers within 6 feet of each other for an extended period of time. And those are all important considerations, Daniel, especially related to retail stores like firework establishments. So nothing specific in the orders that closes a business like yours, but I would say that the general retail guidance that we've issued from the Department of Health, take a look at that, because I think that would be some best practices that you would want to implement.
Great. Okay, and then let's jump down here. I think that we answered a few of these questions that came in at the beginning, but with our content, one question has to do with outdoor seating, and it's can we have stronger messaging regarding outdoor seating?
And that's another great question that we haven't really had a lot of messaging from the health department's perspective about outdoor seating, and that's something that we can certainly follow up on. And again, is why these interactions and these webinars are so useful. Again, I would say when it comes to restaurants, for example, that or bars that provide outdoor seating, right now, look at the language of order number 1, where those would be closed. And until you see guidance from us on that, again, talk to your county public health office and your county health officer on any questions regarding interpretation of the orders or enforcement of the orders. And also, that can facilitate conversations with restaurants and bars that might have outdoor seating on potential exceptions if the answer is no. But really good feedback too, because we've had a few questions over the past couple of days about outdoor seating, and we're working on developing some guidance for that.
Okay, thanks, Stefan. Here's a question about, let's see. Here's a question about the salon. So Sharon, maybe you can help out with this one. In a salon with 2 staff in completely separate spaces, should we turn clients away who show up without a face covering?
I actually think the health department might want to take this.
Yeah, that one might be better.
Yeah.
You're right.
So yeah, thanks, Sharon. And again, I'll try to not be frustrating, but going back to the language of the order, I'll point out that for personal care services, staff are required in the order to wear face coverings. I want to be clear here that that does not mean a respirator or an N95 mask or even a surgical grade mask. It's really a face covering. And if you look at the stuff that's on our website or on the CDC's website, there's good FAQs and tutorials on what should be used for public, face coverings for the public, how to make them, et cetera. So number 1 with staff, that wasn't the question, but it's important to reiterate, that is a requirement in the order for personal care services. When it comes to the patrons of those businesses, the language says, to the greatest extent possible, essentially, customers should wear face coverings. We know that in some scenarios, it might not be possible, or they might have to be removed with personal care, and caution should be taken there, but we know a little bit of flexibility is needed. In terms of whether you should turn customers away, I won't give you legal or operational advice, and would really encourage you to talk to your colleagues and your peers, as well as any insurance carriers you have, or legal advice that you might seek that we shouldn't be giving you. But I would say that from my personal perspective in the health department here, customers who show up for personal care services without a face covering, I don't think would qualify for receiving services here with the language of the order. But again, the flexibility on what could be removed in certain circumstances, that there's certainly some more general language there, and would encourage you to again talk to your get legal advice, or talk to your insurance carriers or your colleagues and peers in other personal care businesses.
And if I can just add 2 cents to that, it does say on the orders that services may be provided by appointment only. So we really shouldn't have people just walking into the salons and barbershops anyway. And then what Josh was saying earlier about reaching out to your fellow salons and barbershops, we've been hearing some really creative things that people are doing. I think that anyone can come into your salon with a face mask on. There's nothing that's going to happen in that first bit of service that would require them not to have one on. So I think that, having them come in when their appointment time is with their mask on, and then it would be up to the stylist to, talk to them about at what point that may have to be removed to further the service. So maybe that helps.
Yeah, thanks, Sharon. I think that it does. And again, this is going to be definitely coordinating with your customers and making sure that you're doing your best to help them stay safe, as well as your employees, I think is definitely key. Here's another question, and we've had this one a number of times. It's definitely one that is kind of an in-between type of situation. I own a dance and tubbling studio. We don't report to anyone and do not belong to any group listed in the orders. or a mix of the same services and issues that childcare and gym facilities face. I'm looking for clarification and classification of dance and tumbling inside of the Wyoming reopening plan, as we want to have clarity and obey all orders. They've contacted their local health department, and trying to make sure they pursue all avenues for immediate and short and long-term plans. So, Stefan and perhaps Stony can talk a little bit about this one, but this is definitely one we've heard a couple times, and so let's make sure that we think about this one as we move forward.
Yeah, thank you, Josh. And Tanya, that's a really great question. And we do have some kind of in-between businesses that I hope I don't frustrate you too much with the answer, but you've done the right thing contacting your local public health office. And I will mention here that folks should know that we're not two separate entities. While there's local control and county jurisdiction, where they certainly have areas that they operate independently, when it comes to public health orders, both interpretation and enforcement, the county health officers work under the supervision and direction of the state health officers. So any advice that they're giving you with regards to these orders in your particular studio would be sound and would come through us. So there's no one that you really need to contact at the state level to make sure that you're getting the right advice. We place that discretion and that local control under our supervision at the county level. So I would trust what you're hearing from your county health office, but totally understand that some of the businesses, we can't capture every type of operation in these statewide orders. And again, I would just say that if you're getting advice, and I don't know those conversations that you've had, but if you're getting advice that is maybe restricting your opening or some part of your operations per the guidance of your county public health office, then you could have a conversation about what an exception might look like. And that again is your venue for having that communication and conversation is what you've already done, which is contacting your local county health department.
Okay, let's see. We've got time for probably 2 more questions, depending on how they go. So let me look here and see if we can get a couple.
Sorry, I was just going to offer that Tanya could also reach out to the licensor in her area, because although she's not a licensed facility, she certainly could benefit from some of the technical assistance and information that we are relaying to childcare providers to help her make that transition.
Fantastic. Thank you. Thanks, Stony. I appreciate that. Let's see. Here's a question from Mike. Can we offer placement testing / high school equivalency testing in person with one individual at a time, both staff and tester, with proper PPE and proper cleaning after each use?
Yeah, great question, Mike. So in terms of testing centers, I think they're kind of contorts into the closure on K through 12 schools, as well as trade schools, colleges, universities, et cetera. 2 folks that you should contact, Mike, when it comes to a testing center and plans that you have to allow placement testing and equivalency testing would be, again, I'll sound like a broken record, a county public health office, but also the Wyoming Department of Education, and the folks there have guidance and have technical assistance available for what an opening or continuation of service could look like for your particular entity. So again, I know I'm probably not making friends here today with my general answers and seeming like I'm punting on this, but we know there's a lot of situations that frankly don't fit into very nicely into some of the order language. So Mike would encourage you contact your county public health office as well as the Wyoming Department of Education, because this issue has come up a number of times.
Great, thanks, Stefan. And we'll take this one as our last question. This one has come up before. It's common. Some are stating that we need to have a waiver signed by staff about coming back to work and customers that use our facility to prevent a legal situation should we get COVID-19. Is that necessary to have? I think the way that we looked at this, and probably you may have heard it before in the discussion today, is that there is nothing in the state order that requires that. However, from a business standpoint and a legal standpoint, that's definitely something you would want to talk with your legal counsel on, or your insurance carrier, to understand that. I think that is the best avenue for you, as it is not required in the state order. But again, that is something that your business will have to handle on an individual basis with your legal counsel and insurance carrier. Anything I missed there, Stefan?
No, not at all. I couldn't have said it better myself. I did, Josh. I know I'm kind of going rogue here, but there was a question earlier that it came up on the previous webinars about massage therapy and personal care services, with some misunderstanding, like you had mentioned, Josh, that they're not allowed to open potentially until May 15th. Just to reiterate, and it's a good question, especially about massage therapy services. Again, like Josh mentioned, if you look at order number 3, the first paragraph of the actual order says those personal care businesses like massage therapy are closed. But then paragraph number 2 says, however, those businesses listed in paragraph number 1 may open if they meet the following conditions. So to answer your question directly about reopening massage therapy services, if you meet the conditions and the requirements that are listed in order number 3 in paragraph 2, you can reopen tomorrow on May 1st. You do not have to wait until May 15th or restrict it to only medical related massage therapy services. So hopefully that's the one time I got to give a clear answer today. That's feels good, but good question, and want to make sure it's clear that if you meet those conditions, whether you're a gym or a personal care service, you can open tomorrow.
Thanks, Stefan, for that, and thank you all for attending. I know that this can be a challenging time, although I think in some cases it is continuing to get better. So we like to see that. Great questions today. We really appreciate everyone joining in. I want to thank my panelists and Warren for facilitating, and really, thinking about this, making sure that we take a look around at our communities, take a look around and talking with our friends and neighbors about how to get through this and how to best do it, finding those best practices that we can take and help us not just survive right now, but thrive as we emerge from this and recover. I really appreciate the spirit of Wyoming small business and the spirit that Wyomingites have to get through this. Frankly, I like to hear the frustrations that you have, because it means that you're passionate about your business, and it means that you want to get back to work and move forward. And I appreciate it, and we'll do our best to help you as much as possible through this. Thank you all for attending. If you perhaps missed some of this or would like to catch it again tomorrow, we'll be having these webinars at 8 a.m. And noon on Friday. And we will be posting the slides that you saw on our wyomingbusiness.com wyomingbusiness.org/transition website later today. So thank you again for joining. And if we missed you, then we'll see you tomorrow. Thanks. Bye.